NLN NEX passing score help. Question 1. Which number is 10% of 300 in this main idea item? Option A, 30. Option B, 290. Option C, 300. Option D, 310. The correct answer is option 10% means 10/100, so 300 times 10/100 equals 30. The other choices come from adding or subtracting the percent, moving the decimal incorrectly, or dividing in the wrong direction. Question 2. During a quick NEX review of an inference clue item, which word is closest in meaning to summarize in a nursing entrance reading item? Option A, lengthen. Option B, deny. Option C, condense. Option D, decorate. The correct answer is option. Summarize means condense, so that choice matches the meaning in context. Lengthen means make longer, not condense. Deny means refuse, not condense. And decorate means adorn, not condense. Question 3. After checking the choices in an author purpose item, which answer identifies the substance dissolved in a solution? Option A, solvent. Option B, precipitate. Option C, catalyst. Option D, solute. The correct answer is option. The solute is the material being dissolved. Solvent does the dissolving. Precipitate is a solid that forms in solution, and catalyst speeds a reaction. Question 4. If a summary task stem gives one clear clue, which choice most accurately summarizes the passage? A volunteer program grew after former patients shared personal stories at orientation. Option A, volunteer programs grow without communication. Option B, orientation should never include stories. Option C, former patients stopped the program. Option D, personal stories can motivate people to participate. The correct answer is option. The passage shows participation increased after meaningful stories were shared. Volunteer programs grow without communication is not supported by the passage. Orientation should never include stories is not supported by the passage, and former patients stopped the program is not supported by the passage. Question 5. When time is limited on a sentence correction question, which answer identifies the group that does not receive the experimental treatment? Option A, control group. Option B, sample. Option C, conclusion. Option D, experimental group. The correct answer is option. A control group provides a comparison for the treatment group. Sample is the participants or items studied. Conclusion is the final interpretation, and experimental group receives the treatment. Question 6. Given the information in a punctuation review item, which probability describes drawing a red card from a set with 6 red and 6 blue cards? Option A, 1/2. Option B, 1. Option C, 2. Option D, 1/2, 1. The correct answer is option. Probability is favorable outcomes divided by total outcomes, so the result is 6/12, simplified to 1/2. The other choices use blue cards, compare red to blue only, or invert the fraction. Question 7. Suppose a similar pronoun agreement item appears on test day. Which word is closest in meaning to accurate in a classroom review sentence? Option A, rapid. Option B, correct. Option C, distant. Option D, casual. The correct answer is option. Accurate means correct, so that choice matches the meaning in context. Rapid means fast, not correct. Distant means far away, not correct. And casual means informal, not correct. Question 8. While working through a timed parallel structure set, which answer identifies the transfer of heat through direct contact? Option A, radiation. Option B, convection. Option C, conduction. Option D, evaporation. The correct answer is option. Conduction transfers heat when particles collide through direct contact. Radiation transfers energy by waves. Convection moves heat through fluid circulation, and evaporation is liquid changing to gas. Question 9. Before choosing an answer in an active voice item, which choice most accurately summarizes the passage? A school added quiet study rooms, and students reported fewer distractions. Option A, quiet rooms increase noise. Option B, distractions are always helpful. Option C, reducing distractions can improve study conditions. Option D, students no longer needed to study. The correct answer is option. The result directly connects quiet rooms to fewer distractions. Quiet rooms increase noise, is not supported by the passage, distractions are always helpful, is not supported by the passage, and students no longer needed to study, is not supported by the passage. Question 10. A student sees this capitalization check idea on a NEX review. Which critical thinking response best fits this situation? A conclusion says a new study method caused higher scores, but the groups were not randomly assigned. Option A, random assignment is never useful. Option B, the conclusion may be too strong because another factor could explain the scores. Option C, higher scores prove every student studied more. Option D, the conclusion should ignore group differences. The correct answer is option. Without random assignment, group differences may affect the result. Random assignment is never useful, does not follow from the situation. Higher scores prove every student studied more, does not follow from the situation, and the conclusion should ignore group differences, does not follow from the situation. Question 11. One clinical scenario practice problem tests this skill. Which milliliter amount equals 1.5 L? Option A, 1,500 ml. Option B, 15 ml. Option C, 15,000 ml. Option D, 150 ml. The correct answer is option. 1 liter equals 1,000 ml, so 1.5 times 1,000 equals 1,500 ml. The other choices use 10, 100, or 10,000 as the conversion factor, which shifts the decimal to the wrong place. Question 12. Several choices look tempting in a community clinic item. Which word is closest in meaning to a parent in a classroom review sentence? Option A, hidden. Option B, temporary. Option C, a minor. Option D, obvious. The correct answer is option. Apparent means obvious, so that choice matches the meaning in context. Hidden means concealed, not obvious. Temporary means brief, not obvious, and minor means small, not obvious. Question 13. For this student survey nursing entrance question, which answer identifies the repeating a study to see if results hold? Option A, estimation. Option B, classification. Option C, replication. Option D, bias. The correct answer is option. Replication checks whether results are reliable across repeated trials. Estimation is an approximate calculation, classification is grouping items, and bias is a systematic error. Question 14. In a short wellness app practice STEM, which choice most accurately summarizes the passage? A report says infection rates fell after staff completed a hand hygiene refresher. Option A. The refresher removed all risk permanently. Option B, training increased infection rates. Option C, hand hygiene cannot affect infection. Option D, training may have improved compliance with hygiene practices. The correct answer is option. The sequence suggests training supported better hygiene behavior. The refresher removed all risk permanently, is not supported by the passage. Training increased infection rates, is not supported by the passage, and hand hygiene cannot affect infection, is not supported by the passage. Question 15. Among the choices in a practice timer item, which increase is shown from Monday 17 to Wednesday 27 in a simple practice chart? Option A, 27. Option B, 7. Option C, 44. Option D, 10. The correct answer is option. The increase is the final value minus the starting value, 27/17 equals 10. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 16. Using the facts in an exam readiness question, which sum equals 1/10 plus 1/5? Option A, 1/10. Option B, 1/5. Option C, 3/20. Option D, 3/10. The correct answer is option. The denominators are already the same, so add the numerators, 1 plus 2 equals 3, then simplify to 3/10. The other choices subtract the numerators, multiply parts of the fractions, or change the denominator unnecessarily. Question 17. Based on the clue in a quick review item, which word is closest in meaning to clarify in a classroom review sentence? Option A, explain. Option B, measure. Option C, confuse. Option D, damage. The correct answer is option. Clarify means explain, so that choice matches the meaning in context. Measure means determine size, not explain. Confuse means make unclear, not explain. And damage means harm, not explain. Question 18. Consider this high-yield hard question concept. Which answer identifies the tiny vessel where nutrient and gas exchange occurs? Option A, vein. Option B, trachea. Option C, capillary. Option D, artery. The correct answer is option. Capillaries have thin walls that allow exchange with tissues. Vein returns blood to the heart, trachea carries air, and artery moves blood away from the heart. Question 19. Near the end of an easy question review session, which choice most accurately summarizes the passage, a clinic sends appointment reminders, and missed visits decline? Option A, reminders can help patients remember appointments. Option B, reminders caused more missed visits. Option C, patients cannot benefit from reminders. Option D, appointments no longer need scheduling. The correct answer is option. The decline in missed visits supports the role of reminders. Reminders caused more missed visits is not supported by the passage. Patients cannot benefit from reminders is not supported by the passage, and appointments no longer need scheduling is not supported by the passage. Question 20. Across similar mock test nursing entrance questions, which answer identifies the transfer of heat through direct contact? Option A, radiation. Option B, convection. Option C, conduction. Option D, evaporation. The correct answer is option. Conduction transfers heat when particles collide through direct contact. Radiation transfers energy by waves, convection moves heat through fluid circulation, and evaporation is liquid changing to gas. Question 21. Since only one choice fits the diagnostic set clue, which dose volume gives 25 mg from a supply of 50 mg per 2 ml? Option A, 0.5 ml. Option B, 2 ml. Option C, 1 ml. Option D, 1 ml, 1. The correct answer is option. Set up the proportion 50 mg, 2 ml equals 25 mg x ml, so x equals 25 times 2, divided by 50 equals 1 ml. The other volumes reflect errors such as doubling the dose, having the dose, or reversing the proportion. Question 22. From the information in a final review item, which word is closest in meaning to contrast in a classroom review sentence? Option A, similarity. Option B, difference. Option C, object. Option D, schedule. The correct answer is option. Contrast means difference, so that choice matches the meaning in context. Similarity means likeness, not difference. Object means thing, not difference. And schedule means timetable, not difference. Question 23. At a testing desk during a question bank review, which answer identifies the organ that produces bile? Option A, pancreas. Option B, gallbladder. Option C, liver. Option D, kidney. The correct answer is option. The liver produces bile, which helps digest fats. Pancreas secretes enzymes and hormones. Gallbladder stores bile, and kidney filters blood. Question 24. Inside a workbook page science or skills item, which choice most accurately summarizes the passage? A study found that students who practiced with timed sets felt more comfortable during the actual exam. Option A. The exam has no time pressure. Option B, comfort never changes with practice. Option C, timed sets remove all content gaps. Option D, timed practice can build exam familiarity. The correct answer is option. The passage connects timed practice with increased comfort. The exam has no time pressure, is not supported by the passage, comfort never changes with practice, is not supported by the passage, and time sets remove all content gaps, is not supported by the passage. Question 25. Through careful reading of a study notes stem, which critical thinking response best fits this situation? A test item asks for the best answer, and two choices are true but only one directly answers the stem. Option A. The longest answer is automatically best. Option B. The first familiar term should be chosen. Option C. Any true statement is always best. Option D. The choice that directly answers the stem should be selected. The correct answer is option. Entrance exam items often include true distractors that do not answer the specific question. The longest answer is automatically best, does not follow from the situation, the first familiar term should be chosen, does not follow from the situation, and any true statement is always best, does not follow from the situation.